All right. Here's some data here. This is data that's a little bit old. It's about 5 years old, but I'll look for some more recent data. But I think the trend line or the trend is that there are certain cancers that we've been able to have more productive outcomes around, and then there are those that are less productive. And as a byproduct of that, that means, that, the death rates have increased, right? So let's just talk about men, and we'll start with the bad news. Bones and joint cancer deaths are on the rise. Brain and other nervous system are on the rise slightly. Liver and uh, intrahepatic and bile duct cancers slightly up, and pancreas cancer slightly up. The good news is that, it looks like starting with prostate, I'm going to go through all of them, but, we are seeing progress along all these other cancers. And, obviously the best one here is lung and bronchus and melanoma of the skin, right? Those are two. And I think, melanoma, I think certainly is because of people are looking at that more carefully and getting more preventative checkups in that space, right? On the women's side, obviously there is well, corpus and uterine um, uh, cancer rates are up, our deaths are up, liver and intrahepatic. It seems to be higher for women than for men, and um, oral cancers are on the rise, and related deaths are on the rise, and then just like men, pancreas is consistently difficult, or the cancer, the death rates are increasing, right? So then you can kind of look across the whole list, and I think you see reductions increasing all the way up to lung and bronchus and melanoma of the skin. So with that said, you can, and these are average death rates, changes in death rates. So, what we're going to explore a little bit is, as you go and look at those like top 10 facilities, is this data consistent? And we're going to do a lot more work with that. And so hopefully we'll be able to kind of communicate that out to people. But again, this kind of shows, you know, um, particularly if you're in that red zone, maybe it's not the best thing to go to your local hospital. Maybe you need to think about whether or not you're going to kind of broaden your search criteria and try to figure out, how do you not end up in one of those numbers, right? We want to give you the most options that you can. And so, as I've stated in probably other conversations, I really think ultimately, as you're for the younger people out there, you really need to be looking at health savings accounts, because that money that you put away is going to give you the freedom to maybe go beyond that local hospital, right? And maybe you don't have financial constraints, and that's great. Um, but if you do, and you do have family history, I highly recommend you look at hospitalization and cancer insurance, because that is a way that you don't have to make enormous investments to get some results and to have that flexibility to kind of get the treatment you need. So whether or not it's with me or someone else, I definitely highly recommend that.